Well, Femtech is a really interesting topic for me, and I'm sure you'll find it equally interesting because it is the intersection of what women's health needs are and the gap in women's health care, as well as the rapid developments in technology, which we're all aware of today. We were just talking about all these different screens we have to manage today. It really is a new skill set, but where it's really being turbocharged is in the area of machine learning. We've all heard about ChatGPT and other AI-enabled tools, and this is certainly being focused as well in the area of healthcare in general, and it offers some unique opportunities, some terrific tailwinds for women's health in particular, which, as we'll see very soon in the presentation, has been historically neglected compared to men's health. And there are issues that we face as women, health issues, that really have just been overlooked for a long, long time. And hopefully Femtech and many of the women leaders involved in Femtech will be changing that and creating better health for women and for societies in general. So here's just like a quick overview of some of the female-centric issues that women face in terms of healthcare. First of all, we are a large part of the human population. That's a lot of digits there up top. I think that's trillions. And so that's the current number. It's probably outdated already by a couple of weeks, the number of women and girls in the world. And yet, despite the fact that the total addressable market for healthcare is at least 50% of the world's population, women's health concerns are systematically overlooked, even in developed countries. Now, obviously, it causes unnecessary suffering to the women, certainly loss of income if women are unable to work or to move ahead in their careers because of health issues or chronic health issues. And it actually costs the economy, in terms of loss of productivity, about $1 trillion. If you look at the combination of lower productivity and increased costs in healthcare. So over on the left, you'll look at some vital stats. These are pretty impressive. So 5 times as many women die of heart disease than breast cancer, which, if we just stop and think about it, look at the amount of dollars that is put toward heart disease research, but not always focused on women and how heart disease presents in women, which is different often than how it presents in men. 2/3 of clinical research on heart and stroke focuses on men exclusively. 70% of chronic pain sufferers are women. So these are issues, some of whom maybe we all face, I know I do, that they're never going to get solved. They can be managed, but they do affect day-to-day living, and you can never check them off the to-do list. So 70% of chronic pain sufferers are women. That's an astonishing percentage. 80% of pain studies are conducted on male mice or human men. So that's, again, something that's quite telling in terms of the gender bias. And 2/3 of the people with Alzheimer's are women. So this is the backdrop that we're looking at in terms of gender-based healthcare. Now, as I mentioned a minute ago, many chronic and very, major health problems present very differently in women than they do in men. For example, strokes, diabetes, heart attacks, and concussions do present differently in men and women. And this could be one of the reasons that women historically do not receive those top-tier diagnostic tests, that may be more aggressive tests, and the timely care that the results from those tests can bring. Now, 1 in 8 Canadian women is estimated to suffer from an unrecognized brain injury that's related to intimate partner violence. And this is linked to an increased likelihood of early onset dementia, as well as other cognitive and behavioral issues. So just putting some metrics behind that, that's 4,500 concussed women for 1 concussed NHL player. Now, nobody should suffer from concussions, but if you look at the amount of dollars that are put aside and directed towards research on brain injuries, the impact of brain injuries on professional male athletes receives millions of dollars of funding annually. And this is not the case for issues relating to brain injuries in women, which can come about in some cases, and perhaps maybe in most cases, from intimate partner violence. So really, this is an opportune time when we have this intersection of healthcare and advances in technology to rethink that XY medical template, which has been in operation for as long as healthcare has been around, and start to make it much more inclusive and consider that the medical template for XX for women should be different. So there is a deficit of reliable scientific data on women's responses to medical treatments. And this is, of course, since a lot of the medical research in the past, and it is slowly changing, is conducted on male, animal, and human subjects. Now, part of the reason for this bias in research is that scientists may have issues where they cannot test certain drugs or certain medical interventions on women who are fertile, in case that might affect their fertility. So that is part of the reason that's been given in the past. But I think with AI, there may be opportunities to sidestep some of those issues. So, I mean, it's kind of a funny example, but it's not funny because it really does speak to gender bias. In a 1986 study, so it's back a few years, on how obesity affects breast and uterine cancer, the entire study was only conducted on men. So, yeah, I don't imagine that the results from those tests were terribly valid or helpful. Here's another example. This is from a study that was just done about a year or two ago from the University of Toronto Faculty of Medicine that really showed the impact of gender bias on women's medical care. So this particular study surveyed 1.3 million adult patients in Ontario over a 12-year period, and it focused on 12 different types of surgeries. And the results were quite interesting because compared to male patients, the women patients who had one or more of these different types of surgeries were 15% more likely to die or experience complications. They were 11%, they had 11% greater likelihood of readmission after the surgery. They had a 32% greater chance of dying within 30 days post-procedure. So that is a curious result. And it turns out that the more negative outcomes only applied when the woman was operated on by a male surgeon. So men had the same post-surgical odds of good results or not such good results, whether the surgeon was a male or a female. So this is yet another example of either conscious or unconscious bias when we look at the kind of care that women get. And again, kind of mapping that back to some of the earlier findings where a lot of medicines, drugs, treatments are tested on men. And so when women are given these types of treatments or medicines, they do react or can react quite differently and sometimes in very negative ways and have very negative outcomes. So Femtech is really an opportunity to create health equity so that both men and women have the same chance of having good health care and having better outcomes when things go wrong and they need, to engage with the medical complex. Here's a quote from Ida Tim. She's the founder of Clue, which was really one of the very first successful Femtech launches. Clue is a period tracker. Of course, it does a lot more, and I'll talk about that in a moment. But in terms of funding for Femtech, there is still a large financial gap. This is her quote: "We're still getting peanuts to play with when you see the amount of money that has been invested into, e-scooters or car sharing compared to the kind of private equity and venture capital investments that go into Femtech. I've already mentioned women are not equitably represented in clinical trials. Social determinants like wage gaps and a lack of affordable access to quality care, diagnostics, and medicines disproportionately affect women. And only 4% of overall funding for research and development, and this is not including venture capital, this is conventional research funding, only 4% of overall funding for research and development of healthcare services and products is focused on women's health, 4%. So what is Femtech? Well, Femtech seeks to improve women's health and to create positive social change through technology-related products and services. So these can be mostly digital services or products such as apps or direct-to-consumer, web-related products. The main areas of focus are menstruation, sexual health, fertility, prenatal health, maternal health, and menopause. So except for the last one, menopause, up until now, most of Femtech products have been focused on period trackers, measuring fertility and so forth. And I'll be talking a little bit more about the last category because this one has really been underserved, and Femtech is now ramping up in this area. And I'll talk more about some of the things that are happening. So Femtech companies are typically led by women founders, but not exclusively, and they're more likely to engage female inventors, female researchers, and female investors. This is actually quite an important thing because studies show that male inventors are much more likely to provide solutions for male-oriented problems, whereas female-led teams tend to solve for both women and men. So Femtech has some very, very positive tailwinds at the moment, and these are likely to continue into the future. Firstly, women are consumers of healthcare products and services. Women make 80% of all consumer healthcare decisions. That's about $500 billion per year in healthcare spending that is directed by women for themselves, but also for their children, for families in general. Now, the total addressable market for Femtech, as I mentioned, it's half the world's population. I don't think it gets better than that, really. So a lot of investors are looking at this area very closely and looking for ways to monetize the opportunities here. Women's wealth is growing, so women are controlling more of their personal wealth and they can deploy it how they wish. So women control 1/3 of the world's wealth. They're adding US $5 trillion to the wealth pool annually. So some of this money is going toward investment in Femtech, and I'll talk a little bit later about some of the women, many of them very well-known women, celebrities as well, who are investing their dollars into Femtech. So the Femtech market could grow to $65 billion by 2027. I've actually seen lots of different numbers. Some are actually higher than this. I guess we'll see how quickly things move ahead. And again, I think AI will turbocharge a lot of this. Women tend to invest based on their values and not as an end in itself. And this also bodes well for Femtech investing because it is something that is not necessarily only to benefit women, but it really benefits society as a whole in terms of greater productivity and greater autonomy. And by 2030, it's expected that the Femtech market will reach $100 billion. But again, I've seen numbers that are much, much higher than this. So time will tell. So these are other forecasts about the market. We saw how in 2021 It was about 4 billion, almost 5 billion. Well, million, but it's much more likely to rise very, very quickly. And I think it is growing very quickly, just based on this data, that it's growing at almost 11% a year. Which I think is very, very encouraging for both women as the end users, as well as, of course, for investors. So I mentioned that in the early days of Femtech, and that was around 2012, which was really the first big launch in Femtech, that product Clue, which is the menstrual and ovulation cycle tracker. So this was really the first big push in the area of Femtech, and it's currently still around. It's doing very, very well. It has 11 million users worldwide. And it was actually the founder of that company that coined the term Femtech. So this particular product provides additional services in addition to tracking cycles, because it also tracks irregular cycles. And this is important because often it's aberrations in menstrual cycles that can indicate deeper problems. And one of those problems could be polycystic ovary syndrome. But other apps are also looking at not just tracking menstruation, but looking for ways to perhaps diagnose potential problems that often are overlooked by conventional medicine. Now, of course, in addition to the gajillion apps that are out there, of course, they're not all great, but there are also things such as bodysuits that use heat and vibrations to alleviate period pains, wearable technology that helps breast cancer patients to recover. And we're really just at the very tip of the iceberg when it comes to all kinds of innovations focused on women. However, because there's money to be made in this area, people are talking about it, it's a trending topic. Of course, it's going to be attracting people who are maybe less than ethical. And here's just one quite hilarious example of 3 German guys who created this product called Pinky. They got a good amount of venture capital funding to produce this. And as you can see here in the photo, it is a hot pink glove. And it is basically a glove that women can put on to then remove their tampons safely and discreetly. So it's basically a dog poo bag in hot pink for women's tampons. So here are 3 guys who created a Femtech product for a problem that does not currently exist. And this is just one egregious example of that. Of course, I'm sure we could all find many more, and there will be many more as well. So it will be buyer beware and investor beware also. I want to talk a little bit about menopause because it is an enormous market. You saw that number earlier of the global population of girls and women. Well, if those girls and women, manage to get to the age of 40, 45, they're going to be entering perimenopause, and this is for many women brings a lot of health challenges with it. And also, of course, there is currently a healthcare vacuum in this area because of gender bias, where historically women have just been told explicitly or implicitly to just deal with it themselves and not to seek care. And when they do seek medical care, often people are just simply not trained in this area and are unable or unwilling to help them. So this is a huge business opportunity, but let's just look at some of the stats on menopause. So perimenopausal and menopausal symptoms, and you see the list below, can last for up to 15 years. So if you think about it, if a woman enters perimenopause and she's, say, 45 when the symptoms start, that's 45, 55, 60. Those are really her most productive career years. This is the time of life where if she is in the workplace, she's probably earning her highest salary. This is typically when men get the very big promotions and the perks and the bonuses that go with that. And if a woman is in a leadership position and she is suffering, as some women do, severely from some of these problems and not getting the help that she needs, this can come with a great personal and economic cost, not only to herself and her family, but also to the enterprise itself and, of course, to the greater society. There are lots of studies that show that 3 out of 4 women experience symptoms that interfere with their lives, and 1 in 4 women experience very severe symptoms. Again, the list is there. Perhaps people on this call, some of whom have experienced these symptoms, they're real. And they do make life and work much, much harder. And hopefully, Femtech products and services will step in and help with some of these issues, which at this time, are often overlooked. The onset of menopause starts from around age 40 to 50. And as I mentioned, it does coincide with women's most productive and lucrative years of employment. Now, there's a lack of understanding and support for women experience symptoms of perimenopause, and it often causes these women to lean out of the workforce. And that could include actually having to leave the workforce because of the severity of the symptoms. Now, most corporations don't have any kind of stated policies relating to healthcare for menopausal women. And this is something that potentially will change. There was something tabled in the UK recently, but this unfortunately did not pass because it was deemed that policies helping menopausal women would be unfair to men. So anyway, make of that what you will. Now, among the group of 7 industrialized nations, women over the age of 50 account for 11% of the workforce. There are 1 million women worldwide who will be in menopause by 2025. 1 billion, I think I said million, 1 billion. And in Canada, over 5 million women are currently over the age of 50. Now, this results in productivity losses of at least 150 billion a year, and that does not include the cost of healthcare services. And one survey found that 50% of respondents said that the menopausal symptoms they experienced harmed their careers. And 10% of women in the UK between the ages of 45 and 55 actually left their jobs due to menopausal symptoms. And, on that note, once you're in this age group, 45 to 55, and you leave your job and you perhaps then recover from some of these symptoms a few years later and want to re-enter the workforce, ageism and lookism and gender bias really make it much harder to find a new job at that age. So you can imagine for some of these women, it creates a very severe hardship and may affect their ability to have a comfortable and even reasonable retirement. Now, when women seek out medical care for their perimenopausal and menopausal symptoms, at this moment, they're unlikely to get good medical care from the conventional medical establishment. So a survey of medical residency programs in internal medicine, family medicine, and gynecology found that medical students received a maximum of 1 or 2 total hours of education about menopause. 20% of medical students received no education regarding menopause, and only 7% of medical practitioners said that they felt skilled enough to treat menopausal patients. So enter the A-list celebrities. I mentioned earlier that there's a lot of investment. There's a lot of interest in femtech. Some of it has to do with products that alleviate some of the symptoms, such as vaginal dryness, dry skin, low energy, and so forth. There are other products that are more medically driven. So here are a couple of celebrities, very familiar faces: Gabrielle Union, Gwyneth Paltrow, Cameron Diaz, Drew Barrymore, Naomi Watts. And these are some of the investments, some of the companies where they have made investments. Naomi is the face of Stripes. I don't know if it's available in Canada yet. And there are quite a lot of products on the market, most of them involving technology, many of them relating to skincare and alleviating menopausal symptoms through herbal supplements and so forth. So there's a lot of activity on the A-list front. And what about regular folks who want to invest in Femtech companies? Well, there are two ways to do it. One way, if you are an accredited investor, that means someone who has a relatively high net worth, you can access venture capital funds as well as private equity funds that invest in technology and healthcare technology. And there are quite a number in Canada, and you can do a bit of research to find them. The other way to do it, which would be obviously easier and less of a financial commitment, would be to look at publicly traded companies that invest in other healthcare companies, either through direct investments, or they are serial acquirers and purchasing smaller companies and startups. So there are a couple of examples here. I mean, in 2022, German drug maker Bayer bought Candy, which is a UK-based developer of non-hormonal treatments for menopause symptoms. There are other examples out there. So in terms of investing in Femtech, you can simply just do it through conventional healthcare companies that are publicly listed, and you can do a bit of research on those. You can see it's not a very good slide, but I mean, there are a lot of startups in this area, and some of them will certainly come to the fore. Some of them, will not thrive, unfortunately, at this time because of the rising interest rates. There's a little bit of a lack of appetite for venture capital and private equity to invest in smaller startups that are not profitable. But there is a lot of dry powder on the sidelines, and I think risk appetite will certainly come back. I can't say when that will be, to support some of these smaller companies and help them and nurture them to develop. But there is a lot of opportunity, and I think Femtech has long legs. So the future looks bright for Femtech. And I just wanted to thank everyone for tuning in today to hear about Femtech.